Welcome, everyone. This is Dr. Jaitly, your cardiologist from New York, on your favorite virtual site, which is MuniMeterHealth, and that is your source for learning cardiology and, of course, all knowledge about human heart awareness. So, welcome again to MuniMeterHealth. We are dedicated to serve you for clinical education primarily. So, we'd like to improve that and, of course, improve the patient education as well. And that's the whole idea, so that we have seen that if you medically educate the staff and the residents, the fellows, and of course combine that with improved patient health literacy, the chances are your clinical outcomes will be definitely better. And that's the whole idea, wanting to sort of use this as an educational tool. And mind you, this is a medium only for educational tool, and it's not a medical advice, it's not a syllabus, it's a supplement to the syllabus that we normally always suggest. And of course, if somebody's having an emergency, if it's in the United States, please dial 911, call for an ambulance, go to the nearest hospital, nearest doctor, reach out for one right away. Okay, so having said that, let's delve into the subject matter. The matter of the subject today is, what is non-compliance behavior? Now, it has been listed as non-compliance behavior, if you will, and let's call it NCB in our future discussions. So this is a very, very important entity. Primarily, it encompasses so many things. So let's start with one first. It's the non-adherence, for instance. Let's pick that up. Non-adherence to appointments, if you will. Okay, so patients are not keeping the appointments, not coming back their follow-ups, and etc. Diagnostic testings, like they don't follow up with the patients, tests that have been advised, or sometimes even when the patients are required to come back for test reading or discussions, then again there's a default rate. So it's a good idea that the patients who are watching this, please, that's non-adherence is one of the things that's commonly the source of not able to heal, not able to control your illness, and as a result, things can progress for complications and even far stages in your illness, whether it's diabetes, whether it's hypertension, whether it is coronary artery disease, whether it is cholesterol, which is unmanageable, or what have you. So those things can progress, and as a result, things can go primarily because of the non-compliance behavior on the part of the patient. So there is an entity there. We all have, to an extent, I would say. Again, there's no way to really use these parameters as to, because it's a broad term. But the fact is that we all have a little degree of non-compliance everywhere, non-adherence. For instance, if somebody was to take penicillin for 4 times a day for 7 days, the chances are he or she will miss 1 or 2 doses. But if somebody's missing 80% of the dose, that's a severe non-compliance behavior, okay? Or somebody does not even go out and fill up the medication, or the medications are filled and patient is not taking it. It's maybe sitting in the drawer, so that's again non-adherence. But so there is something. Now, very importantly, not realizing that the illness can be cured. So understand that the illness is real. So illness is real is very important too, for the patient to understand that. And a lot of the times, patients may walk around with a myth and say, look, my blood sugar is reported as 320. I'm going to control it with my own diet and forget about the pills and the meds. No, it's not so. If that's alarmingly high your fasting sugar has been, then the chances are, if you do not treat yourself, you'll end up in a coma, or a difficult state to treat outpatiently, and you may end up in the hospital for several days or weeks. In any case, you'll require some treatment anyway. So might as well just stay out of that complication and keep the prevention going. And that's what the non-compliance behavior addressing is. We're trying to prevent the progression of the disease. We are trying to make sure that you don't develop any complications, whether it's diabetes, hypertension, or cholesterol, or advanced atherosclerosis. So this way, the target organs specifically, so we know the target organs from hypertension per se. It's a silent killer, we know that. So hypertension is, for instance, a silent killer. It can affect the brain and lead you to develop a stroke. We call it a CVA. Or somebody may end up getting an MI or a heart attack. Or somebody may end up getting a renal failure, and so the renal damages can occur. Or somebody may end up getting a peripheral vascular disease. So hypertension being a silent killer, Joe, what's in the number? Obviously, a lot of people will say, okay, well, my number was 170, 120. Pick a number. Now, the true normal blood pressure should be 120/80 or in that range, and the doctor is taking all the efforts to go over these meds for you and to advise you and say, look, this should be a diet, stop your smoking, and don't overindulge in alcohol, and your pressure needs to be managed, because that pressure is just a number. But what's happening is, now let's go to the schematic, because that's where the changes are happening. Now, if this is your heart, which I normally always draw in my schematic, and here's the aorta that's coming out as an offshoot, and these are your valves, and being not such a great drawer, as you may have seen already in my previous video presentation, but just gives you an idea as to where these coronaries are. So the left coronary divides into two, the right coronary runs all the way around the right heart border. Anyway, the coronaries are supplying the heart, and heart is supplying the body, as we all know. So what is happening is, now you may develop some, if the cholesterol is unmanaged, for instance, the coronary artery disease may progress. Or if the high blood pressure is untreated, the heart will suffer a brunt, because then the left ventricular hypertrophy will occur. So this is very, very important. And so target organ damages can occur, and likewise an MI can occur. That means, say if there was an obstruction that was developing here, you could develop angina or heart attack here in this region. And that is considered as irreversible damage. So illness is real. The point I'm making is illness is real, and that needs to be stressed to the patient, as of course. Now, the medications are real. The medications work. So we should know medications work. Why? Because this is important. They are good medicines, and the doctors, they trust certain medications, and they're prescribing you based on the guidelines that they have from the colleges, American colleges or European colleges, or wherever India colleges, where they have trained or they have the affiliations, the guidelines have been laid out. So the meds work, and there is a therapeutic regimen that has been prescribed or ascribed to you. So you must have a trust in that the meds work, because the doctors trust it. So it's very, very important that the physicians actually sit down and go over that and work with the patient. Say, look, I'm going to add a medication today in order to control your pressure. And then just follow up in 2 weeks later and say, look, your pressure is controlled, or it's not controlled. I think we may end up increasing the dose. Or 4 weeks, 6 months down the lane, etc., the doctor will say, I think it's about time you add a second medication, because your pressure is getting controlled but not totally controlled as yet. So it's very, very important that all this discussion goes into to improve the non-compliance behavior, which is a huge issue. And these are all clinical skills that the doctors, the medical students, the residents and fellows will develop over a period of time. It doesn't come out overnight. Neither did I have that. But the fact is that in my 35 to 40 years of being a cardiologist, I started to work with my patients and make sure that they understand the effects and the side effects also. It's very, very important that the side effects and the effects of the medications are being explained. So effects and side effects, they should be explained. As simple a thing like an aspirin could be forgotten. And again, aspirin is a wonder drug. It saves lives. But the fact is that, what if the patient was not told that the aspirin can hurt if you take on empty stomach? Similarly, like a simple thing like a nitroglycerin, for instance, an aspirin, for instance, I gave you an example here, ASA, nitroglycerin. Again, always don't forget to ask for the allergies, please. Very, very important. And this is a good subject, because, it's very important that the patient, unless the patient is not aware of the allergies, that's a different issue. But asking for allergies, just a simple question, is very important, specifically for aspirin, penicillin, and every drug that's being started all the time new to the patient. So aspirin, nitroglycerin, obviously advise the patient to take it for chest pain, but also give 2 or 3 more instructions with that. Make sure you sit down because you're having the pain, you're walking or climbing the stairs. Make sure you find a bench someplace in the park or wherever you are, up the stairs, up the steps. Sit down, then take the nitroglycerin under the tongue. So the instructions have to be very, very clear. And we can go on and on, but there are so many things to be talked about in non-compliance. And again, because by the way, the patients really stopped taking the medicine if a side effect was not told and the patient developed a side effect. So it's very, very important that we understand that as well. So non-compliance, partly is because of so many reasons. Then do not forget the diagnostic tests. As I said, they have been advised to the patients to go for certain tests, like an MRI was ordered, or maybe an echo was ordered, or somebody has to go for a stress test, and that was not followed. Again, though, the onus is definitely on the clinical practice that they should remind you. But the fact is that, say, a mammogram was ordered, a stress test was ordered, that diagnostic test should be completed, because otherwise you're not moving the block from A to B, and as a result, the disease is still, the doctor's still working up the patient, and we do not have that information. So it's very, very important that non-compliance should be addressed thoroughly with the patients per se, and follow up. Likewise, it's true with the reminders to fill up the medications. Like the meds need to be filled up and on a regular basis. And today you have a computerized system. Of course, that will advise you whether or not the patient is going back and filling up these meds. It could be an asthma medication. It could be because this way you can avoid an asthmatic episode at 2 a.m. And obviously the doctor's clinics are closed, and you'll end up into the emergency room, God forbid. So the whole idea is wanting to see that you have your meds filled. You always have your emergency medications in your briefcase, if you're traveling somewhere or whatever, or in your office drawer, or even at home. So this way you always have an access to your medications which are required in emergency, and then medications that you should be taking routinely anyway. Okay, so non-adherence, and we'll be talking about non-compliance behavior and more so in other videos as well. But just so that I give you an idea as to what non-adherence and illness is real, meds are working, and of course meds work and illness is real. It's all because of the trust. Remember, you have to have a trust in the doctor. You have a trust in the meds, obviously, and you have a trust in the counselors. And of course, the counselor is telling you not to smoke, not to drink. Obviously, he means it or she means it. And very importantly, of course, you have a trust in the tests that are being ordered. And then, of course, you have a trust in your medications, as I said also. So all this trust is very, very important, and that can only be developed once the doctor-patient relationship is developing over a period of time, and he or she is able to explain that, sit down and tell you, look, these tests are important, there are some side effects, there are some effects, and of course, very importantly, that we'll be watching you very closely how your blood pressure comes down. We'll also be watching you if you're developing any complications like target organ damages, etc. So all of that will be very, very nicely analyzed by the physician, and of course, the patient has to adhere. And there's no other way that the patient's condition is going to get better. So I consider this non-compliance as a huge, and again, today's practices, from studies to studies, I'm not quoting a study here, but I'll tell you that's anywhere between 50 to 60% of the patients today. And some studies have even reported up to 75%. 75% of the patients are non-compliant. They have NCB. So one way or the other, you'll see that, whether it's a mild degree of NCB, moderate or severe, whatever grade that you may just put in, but almost half the patients are not taking their medications. It's very unfortunate. So again, I cannot emphasize this, and patient education is number one for us, important to improve the clinical outcomes. And so clinical education along with patient education is so very important. I remember my professor once always told me that, and that was very early on. The doctor should not only know how to write a medication, but also should know when not to write a medication. And same, it's true that I always say that the doctor should know when to pick up the pen and write a script. But the doctor should also know when to put the pen down and not write a prescription. So it's very, very crucial for us to know. And of course, the doctor is knowledgeable anyway to understand what the effects and the side effects are, and sit down and go over all these meds thoroughly or their staff can do that if the doctor doesn't have time. But all this non-compliance should be addressed very, very thoroughly in all individuals specifically. So because, as I said, almost half the population of the patients in any clinic, in any hospital, it's being contributed by non. Why do you think heart failure patients are showing up the emergency rooms? Primarily because of either non-compliance and a diet. Now, we haven't talked about diet here at all. So diet is very important. They've been told to be salt-free. That's a non-compliance. They're having salt. All it takes is one salty soup bowl, and that can throw them into a heart failure episode. So it's very, very crucial. Most 60% of the readmissions to the nursing homes are occurring because of non-compliance, because the patients did not or forgot to take the medicine. So they're mindful of reminding. So the families, the loved ones, and the social worker and the nurse aides who are coming in to check their patients off and on during the day or during the week, they should be reminding, keeping a track, give them a pill box, and there's so many things we can talk about in this video episode. But just so that you know, I've touched upon non-compliance as a huge entity which really contributes to enough morbidity and mortality, unfortunately, to our patient population. Again, so long. See you again on the next video. This is MuniMeterHealth. Stay tuned.